Welcome back to the Combat Athlete Physio YouTube channel, where we take human movement science and bring it to the combat sports. This is module 105 of our Intro to Combat Sport Biomechanics course, where we look at the cervical spine and its movement. And just as a reminder, this will be the structure for every single joint. We're going to be breaking down three things for each movement. First is what each joint movement is doing relative to the anatomical neutral position. The second is we'll identify the plane of movement. And finally, we'll look at the axis of rotation of each movement. So for the four movements today, we've got flexion, extension, side bending or lateral flexion, and rotation. And as always, we use the Human Anatomy Atlas app to help us visualize these things. Okay, so first we have cervical flexion. And for each of these movements, I'm going to try and do my best to give you a nice kind of full view of each movement and just see what's happening before we break it down. Okay, so we're going to pause here and we're going to look and see what's happening at anatomical neutral. Actually, let it return back to the neutral position so it can actually be true anatomical neutral. Okay, so pause it there and let's go to the anatomical neutral position. Cervical flexion is just the act of bringing the head forward. Okay, so you have your head starting in that neutral position and the head comes forward, the chin gets closer to your chest, and then you return. So that movement, if we look at the plane through which that movement is occurring, we can see that that plane bisects, theoretically, the body into right and left halves. And we know that that plane of movement is the sagittal plane. And so in order for something to be happening through the sagittal plane, since we learned the axis of rotation in the previous models, that axis of rotation has to pierce through the plane in a perpendicular fashion. And the axis of rotation that does that is the medial to lateral axis, or lateral to medial axis, whichever one you want to call it. So cervical flexion from anatomical neutral brings the head forward, brings the chin closer to the chest at the neck. It moves through the sagittal plane, and it moves about a medial lateral axis. Next, we have cervical extension. Okay, so let's play it, and then we'll give you this nice round view so you can see what's happening from all sides in all areas. And as it gets back to anatomical neutral, we'll pause here. So what is the act of cervical extension? Well, cervical extension is doing essentially the opposite of cervical flexion. It's bringing the head back, or the back of your cranium would get closer to this portion of your back. So let's watch it in action, and we can see that the cervical spine, it's happening about the cervical spine, but the head is moving backwards as if you're looking up to the sky without moving your shoulders again or without bending the rest of your spine. That's cervical extension. All right, so let's identify what's happening with cervical extension. Well, even though it's the opposite movement, in the opposite direction, it's happening in the same plane as cervical flexion, because we see I've drawn the plane that it's moving, bisecting the body in right and left halves, which is the sagittal plane. And then we know that the sagittal plane requires a medial to lateral axis. So very much like cervical flexion, even though the movement of cervical flexion is bringing the head backwards or looking up to the sky, it's moving through the sagittal plane and about a medial to lateral axis. And next is cervical side bending. So we'll give you a nice view here of the plane of movement, the axis of rotation, and what's happening whenever the head is moving to the side like this. Okay, so I kind of gave you the answer. We'll go back to anatomical neutral, make sure we get oriented, and whenever we press play, we can see that if you were to have an ear here, it would be moving closer to the shoulder without moving the shoulders. So as you tilt your head to one side, that's essentially cervical side bending or lateral flexion. All right, so let's look now at the plane that it's moving through. So the plane through which it's moving is, that I've drawn here, is cutting the body into front and back halves. And we know that the plane of movement that does that is the frontal plane. And again, from our axis of rotation module, we know that the axis of rotation that pierces through the frontal plane has to be anterior to posterior, posterior to anterior in nature. Okay, so we've got cervical side bending, which is the act of just tilting your head to one side without moving your shoulders, is moving through the frontal plane, which is cutting the body into back and front halves, and is moving about an axis of rotation that pierces through that plane in an anterior to posterior direction. Okay, and next we have cervical rotation. So cervical rotation is just the act of turning the head to the right or to the left while your shoulders are stationary. It's a little bit easier to see from this aerial view. Rotating would just kind of follow the neck. All right, so as it returns back to this anatomical neutral position, we know that it's turning the head to the right or to the left. Now let's look at the plane through which it moves. This would be my favorite, the transverse plane, since it's and I drew it at the head so it would be easier to visualize. Again, it's not exactly right on that kind of like the 90-degree angle that we want, but it's easier to visualize here at the head since that's the body part is moving. So we see that cervical rotation is moving through that transverse plane, and since we know that the transverse plane requires a vertical axis to pierce through it at 90 degrees, we know that that's the axis of rotation that it's moving about. Okay, so cervical rotation is moving through the transverse plane, which requires it to move about a vertical axis. The cervical spine of the neck is super important. It houses the upper part of our spinal cord and connects our spinal cord to our brain. It's one of the most vulnerable parts for our spinal cord, the central nervous system. The movement of the cervical spine cannot be overstated. It helps us understand the mechanism of injury when somebody gets punched or kicked really hard in the face. And having a good understanding of the biomechanics of the cervical spine can also help us with things like avoiding neck injury. So, as usual, it's quiz time. Question number 1. You've got a fighter, his opponent hits him in the face, and it spins to the left really hard and knocks him out. At the cervical spine, what is the axis of rotation and the plane of movement that is occurring? Question number 2. You're rolling with somebody and they've taken your back, and they try to sink in a rear naked choke, and you tuck your chin down to your chest in order to protect from the choke. What is the axis of rotation and the plane of movement happening at the cervical spine? Question number 3. True or false? Cervical extension happens in the frontal plane. As usual, all these answers are going to be in the pinned comment of the next module, which is module 106, shoulder movement. I'll see you guys then. Thank you guys for watching.